Welcome to the Dr. America Show here on the WEAC Radio Network. I am your host, Dr. Sanjeev Sriram. Thanks for joining us again. So this week, our main focus of the episode is going to be about immigrant health. And the reason why we chose this week was because May 1st is typically a major important day for immigration activism. And as we all know, immigration reform is still, some of our undone homework in this country. And the reason why I'm kind of like bringing a health perspective to that conversation is because health is often overlooked when we're talking about immigration reform. And now some of you may have noticed that I am not wearing my usual Captain America shirt. I've got my Superman shirt on today. And the big reason why is because I actually kind of feel that there's something to be learned from the story of Superman. But more importantly, I think it's to learn from Superman's parents, his adoptive parents. That's Jonathan and Martha Kent. So for those of you who don't know the story, Superman, was born Kal-El as an infant on Krypton. And just as his planet was about to be, destroyed from within, his parents launch him on a rocket ship, and he goes sailing through space, and then he ends up in Kansas, and he's raised by Jonathan and Martha Kent. So I've always felt that this is a quintessential immigration story because as, Kal-El grows up as Clark Kent in Smallville, Kansas, he's learning about truth, justice, and the American way, and largely because of the influence of ordinary Americans like Jonathan and Martha Kent. And I feel like their example is what should be inspiring our conversation about immigration reform, but also how we deal with health policy as we invite our fellow Earthlings on this planet to join us as Americans, and how we extend health justice to them. So, just to kind of put like some numbers in perspective, actually among children, American children, we're seeing a huge boom in the child population from immigrant children. So just between 1990 and 2010, the number of children with immigrant parents more than doubled from 8.2 million to 18 million. That's huge. And, and that accounts for most of the growth in the U.S. child population over the last 20 years. And, the American Academy of Pediatrics defines immigrant children as children who are foreign-born or children born in the United States and live with at least one parent who is foreign-born. And immigrant kids do have it extremely rough. We're seeing that, 30% live below the federal poverty line. And that's despite the fact that 66% of immigrant children have like at least one working parent. And they also suffer from inequities in their access to healthcare. So today's episode, we're going to be exploring a lot more of that. Recently, the California state legislature has been working on some policies that would allow undocumented immigrants to enroll for health insurance through Medi-Cal, which is their state's Medicaid program. And they would be allowed to access the state's health insurance exchange called Covered California. And, previously, the Affordable Care Act, Obamacare, said that states could not do this. They cannot enroll undocumented immigrants through the exchanges, and they had some pretty strict rules about how Medicaid was supposed to be used. But what California is going to do is that they're going to apply for a waiver from the Department of Health and Human Services. And we'll have to first see how the State House feels about the policy in general. Then we'll have to see what the feds say. But this could be a really big deal, but in California, because they have over 1 million undocumented immigrants in California who don't have regular access to healthcare. So this is huge. I've got my fingers crossed. And, the thing about all of this, like the reason why I bring up these examples is that immigrant healthcare is unnecessarily complicated in this country. And it really doesn't have to be. Like if you feel like your head is spinning just from what I told you about, California and how tricky all that sounds between like, okay, it has to get through the state house, then it needs to get through a federal waiver. But if the waiver doesn't work out, they got to come up with like their plan B. If all of that sounds, really complicated and confusing, believe me, that is just the tip of the iceberg when it comes to how immigrants have to access healthcare in the United States. And what's tragic about it is that none of it has to be this way. It really doesn't have to be so hard for the richest country on earth to live up to its immigrant values, but here we are. And the sad thing is that, we can and we should make it easier for immigrants through every step of the process to get the health care that they need so that they're experiencing health justice as they're, joining us, in the American journey. I'm really excited about today's guest who's going to help us kind of like make sense of a lot more of all of this. That's Ms. Julieta Garibay from United We Dream. If you guys haven't heard of United We Dream yet, you definitely got to check them out online. They do a lot of fantastic work on immigration reform. I feel like I've learned so much from just visiting their website, following their tweets. They're really a fantastic group of activists and have really educated so many of us about what immigrants are struggling with. And I'm really excited to have, Julieta on the program and help us make sense of how, immigrant healthcare is so broken in the broader immigration system. So just to tell you a little bit about Julieta Garibay, she moved to the United States at the age of 12 from Mexico City and lived in Texas for 20 years before moving to Washington, D.C. And she holds a bachelor's degree in nursing, a master's degree of science in public health nursing, and all that came from the University of Texas, where she graduated with honors. In 2005, she co-founded the University Leadership Initiative at the University of Texas, Austin, one of the first undocumented youth-led organizations in the nation. The University Leadership Initiative promotes higher education and civic participation amongst immigrant youth, and Julieta is currently a member of ULI's executive board. She was also a founding board member of United We Dream and has served in multiple other roles in the network. We're really excited to have her on the program. I can't wait to get our conversation started with her. Julieta, are you there?
Yes, can you hear me?
Yeah, hi, how are you?
Great, how are you, sir?
I'm good. Thank you so much for joining us today. So, I just kind of introduced the audience, to your amazing bio. I think that you're definitely, very knowledgeable about, the American healthcare system. But I think that, your own immigrant story is a compelling influence on your perspective. And I'm really excited to have you on the show today.
Oh, thank you for the invite.
So, when I used to work in LA and I, saw patients in clinic, and I know that many of those immigrant families avoided going to the doctor because they were worried about being reported or getting deported. And, can you help us, bust this myth? How do we make sense of that? And how can we, dispel all of this so that immigrants can be treated with some care and dignity when they go to the doctor's office?
Yeah, that's a great question. I think one of the first things that definitely comes to mind is living undocumented for 21 years in this country. I still remember clearly my mom telling me you're not allowed to get sick because we would never be able to afford to actually pay the medical bill. And so I think many of the undocumented families still have that fear that, oh, how am I going to even afford to go to a hospital or even pay the bill? So I think that's one of the main worries. But then as you start also thinking of what actually some advocates have done to ensure that there is some type of treatment provided for undocumented families is to also remind some of our communities that actually they should be able to go to community health centers. Many of these centers might have maybe a fee waiver or a sliding scale where, depending on how much they earn, they can receive some care. I think many people in the undocumented community are very concerned that they might be asked for the immigration status if they seek medical help. But it must be known that in community health centers, people are not collecting immigration status or information about it, but rather they're hoping to actually provide some treatment for them. I think also something very important to remember is that regardless of the immigration status, people are very much eligible for emergency Medicaid, and so that's something that they should definitely use if the need is there. But that's some of what some of the undocumented community face when they try to get some health care.
Now, that I'm glad that you brought up the point about Medicaid, because even emergency Medicaid has a time limit on it. And if, from what I've understood, there are immigrants who are, waiting, and like even now, like with a lot of the immigration reform bills that are being discussed in Congress, those paths to citizenship, they include some of these waiting periods for accessing, I guess what you could call permanent Medicaid, but also other programs like, food stamps and housing vouchers. But now, can you tell us a little bit more about some of these waiting periods? Because, it sounds like emergency Medicaid is there temporarily, but, it sounds like there's a long wait for some of these just basic needs.
Right. So I think something that must be remembered is that in 1996, there was the welfare reform, which basically created many barriers for immigrants to access health care. And so what it basically said is that only qualified immigrants, which include legal permanent residents, or many people call them green card holders, are eligible for health care. However, they created also what's known as a 5-year bar. So even if you're qualified, it requires you to wait out 5 years before you're eligible for Medicaid or other public benefits. And so it still makes it hard for those people who are even lawfully present, as some people would define them, that they still have to wait out before they're actually eligible for some of these programs.
So I just want to, I just want to ask you something right there. So you're describing, people who are following the rules. I mean, like, these are the folks that, most of, I guess, like, you could call them, like, opponents of immigration reform, or people who are hesitant to support immigration reform. They do support these rules. And even so, what I don't think a lot of Americans understand is that even for people who are following the rules, as they currently exist, it becomes hard to access just basic health care.
Right. I guess it depends how you define the whole following the rules or not. But yes, even if people who are legal permanent residents who have gone through a whole process, they're not completely eligible for all the benefits, and so they have to wait out 5 years. And I do agree. Many people believe that, you're undocumented and you get all these benefits. Well, that's not really the case. And even when you do become a legal permanent resident, there's still a long waiting period before you're actually able to access many of the healthcare benefits that are available in this country.
Wow. And the same thing applies to things like, food stamps and housing vouchers, or do you get access to that sooner if you're an undocumented immigrant?
So,
or if you're an immigrant who's going through the process, let me put it that way.
Right. I think so. There's it's multiple tiers. So if you're undocumented, you're not eligible for many of these benefits. But it also must be talked about mixed status families, and so which are very prevalent in the community. You can have maybe someone in a family that you might have a U.S. citizen, and in the same family you might have an undocumented person. For example, when I was undocumented, my mother and my sister had been able to regularize their status. However, I was the only one who was undocumented for at least another 2 years before I was able to adjust. There's also, for example, when there's two parents that might be undocumented, but then they might have a U.S. citizen child. And so it must be pointed out that the child, if the child was born in the U.S. and is rightfully so, they have rights as U.S. citizens here, and so they are eligible to get some benefits. And so what many people don't realize is, or they might be scared because of what we were talking about at the beginning of the discussion, is many people are very scared because they're undocumented, and they think that maybe if they try to access some much rightfully given benefits, for example, for the U.S. citizen child, they might get in trouble because they might be asked for immigration status. But so we must let the community know that if your child is a U.S. citizen, he has rights and he has access to health care, and he should. And so when they're U.S. citizens, they should be eligible for, or they should be applying for the programs that would actually help them in regards to having access to health care and many other benefits.
Now, I guess what I am interested in learning about, and you can probably help me clarify this, is that what's being done in either the federal government or the state government to help these children get the care that they need? Because, as you described it, it is their legal right. And so, it sounds to me like there's an education gap and a communication gap between the people who need the care and the people who know what the rules are.
Right. I think there's a lot of work to be done. So many of our community, at least my mom, and I know many of the immigrant mothers and fathers that we work with, they get their information through word of mouth. And so I think what's really important is to remind maybe your listeners and people who work in the community to tell people, if you have a U.S. citizen child, he or she does have rights to enroll in the different programs related to healthcare, related to other benefits that they're eligible for. I think they must know that there's also, of course, community health centers that they have open doors for undocumented immigrants. And depending on the state, they might have, like I said, a sliding scale. Some of them don't, but those services are available.
Okay.
So that we don't end up with people with not getting any care when they could have gotten preventive care and end up having to do emergency care, which is even more scary, more overwhelming, and of course even more costly for the families. And so they should keep that in mind. There are services available. It's just a matter of maybe helping people get the word out there, and also making sure that there is maybe the help of healthcare providers who are culturally sensitive.
Yeah.
I know many times my mom was always scared of taking me to the clinic, for example, to get my yearly checkup to go into school, because she would always wonder, are they going to check my status? And so many times the healthcare providers might not know how to ask or what to ask.
Right.
But that's also one of the things that healthcare providers could also work in.
So, let's explore that interaction between, the immigrant patient and their healthcare provider. What are some of the health issues that might be more unique to immigrant families and what they face when they arrive here?
Yeah, I think it all depends on what when they arrive.
Mm-hmm.
I think some of the main things, at least for me as a Latina, have been a lot of the concerns that many people have, and actually the fact that many of the Latino communities still don't talk about specifically reproductive related issues. For example, breast cancer, prostate cancer. Many of our communities still are very quiet about those issues, or there's still some taboo or some shyness. They shy away from talking about those issues, and so many times what happens is maybe the woman or the man might be having issues in regard to their reproductive system, and yet they don't talk about it, or they don't say, hey, I'm feeling sick with this, or I'm having these issues. And so many times what happens is they end up having, for example, specifically on cancer, you end up having people whose the illness has advanced so much that it's really hard to provide treatment. And so I think for immigrant communities, that's a huge issue.
Mm-hmm.
For example, when you talk about refugees, I think that one of their main issues are, for example, mental health care issues.
Yeah.
They're refugees for some specific reason. Maybe they were trying to flee their country because of violence or because poverty or persecution. And so many of the times they definitely would need some mental health care when they arrive, and it could be that it's a long-term treatment that they could need and should seek. And so many times maybe the healthcare provider might not know exactly how to best address it. And also talking about the immigrant families, I think I still remember many times going with my mom to translate for her became like my second job, I guess, as one would say. But that's what happens in many families. So you have maybe a child who learns the language easily, and so when they have to go, not just with healthcare related issues, but also with any other issue that's happening with the family, the child ends up having to translate for them. And so many times when you're talking about healthcare, it can be very overwhelming for a child to try to translate healthcare related issues about their parents when they're personally are not even aware of like their entire body or how it actually works. And so I think that's one of the biggest issues. How do you make sure that you're not just asking the child to translate when they're like 10, 12,
Right.
15, when they're barely trying to understand their own bodies, and yet you're asking a child to actually translate. And so I think a great advocacy point would be to actually provide translators in the clinics to make sure that they're actually getting the information they need from the patient and not putting the child or children in a very rough spot where actually you're not even getting the right info that you need to provide the right adequate health care.
Yeah. Absolutely.
Yeah.
So, I mean, like, I think that, we've been actually talking about some of the things that were actually in my next question about what are some of the things that American healthcare providers can do to improve their care. And, we've covered how, cultural competence is a major issue. Translators are a major issue. But it feels like there's still more that, American doctors, dentists, nurses can do to improve the quality of care that immigrant families receive. Any other thoughts on that?
I think one of the biggest things it could be like, we're not here to ask you about your immigration status. We just want to provide you with the health care that you need. I think that just would really help. Like I said, many people are really scared of that. You come to a country that you're foreign to, and you're hoping that you'll be able to succeed and be free. But yet, if you end up in any system, like the healthcare, even in school, many people are still very scared of, like, what if they ask me for my immigration status? And so I think if providers are able to express, we're not here to ask for any immigration status, we're here to provide you with the treatment that you need. I think the whole conversations, it would definitely shift on how people actually share what they're feeling or what their symptoms are or what else do they need from a healthcare provider.
Right. So, thank you so much for joining us on the show today. I wanted to, send our listeners to United We Dream. So how do they find you online? UnitedWeDream.org.
Okay. Majority of their work is mainly focused on empowering immigrant youth and families. But if y'all want to know more about us, definitely visit our website, check us out on Facebook or Twitter. We do a lot of stuff that makes sure that immigrant communities are treated with fairness and equality.
All right. Well, Julieta, thank you so much for joining us today on the program. We really appreciate your insights and your perspectives on how we can make immigrant health a dignified journey for all of us as growing Americans. And thank you so much for joining us today.
Thank you.
All right, guys. So when we come back, we're going to be talking about some other headlines in the news. You've been listening to the Dr. America Show here on the We Act Radio Network. I'm your host, Dr. Sanjeev Sriram, and we'll be right back.
My name is Joe Thompson. I'm 29 years old and I have a career that I love as a systems analyst. Career. It still sounds cool to say that word. I never could have gotten on this path without a college degree. And if the college me were here, he'd tell you.
I never would have gotten to college without Big Brothers Big Sisters. I could have ended up anywhere, on the streets even. But college? Joe Thompson? Not likely. My big brother helped me out. He taught me I could do anything, at a time when a lot of people were saying just the opposite.
And to a 7-year-old, that means a lot. My big brother's name is Phil, and Phil is the reason that this 7-year-old grows up to be a systems analyst.
Whether you donate money or time, you're helping Big Brothers Big Sisters help a child, and that can last a lifetime. Start something today at BigBrothersBigSisters.org. Brought to you by Big Brothers Big Sisters and the Ad Council.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back to the Dr. America Show here on the We Act Radio Network. I am your host, Dr. Sanjeev Sriram, and I want to thank our previous guest, Ms. Julieta from United We Dream, for joining us on the program today to talk about immigrant health. I think that it's a valuable perspective to keep in mind as our members of Congress and our different state houses discuss immigration reform and immigrant health policies. I think that there's no reason why the richest country on earth can't extend basic dignity to our newest arrivals in our great American family. I think that it's a simple case of health justice that doesn't need to be as endlessly and needlessly complicated as it is. But thank you to her, and thank you to United We Dream for sharing your insights and perspectives, and for all of your activism and social justice work. So there's a lot to cover in the health news today. So today is April 28th, Tuesday, and over at the Supreme Court, they're hearing a major case about the legality of same-sex marriage. And the reason why this is once again a health issue is actually connected to those of you who did the Ice Bucket Challenge. Hopefully you remember that the Ice Bucket Challenge is connected to ALS, that's Lou Gehrig's disease, and what that has to do with gay marriage is actually that the lead petitioner for the case that is being heard by the Supreme Court is Mr. James Obergefell, who wanted his home state of Ohio, which bans gay marriage, to recognize his Maryland marriage to John Arthur as Mr. John Arthur was dying from amyotrophic lateral sclerosis, or ALS, also known as Lou Gehrig's disease. What Mr. Obergefell wanted was to have his name on Arthur's death certificate as the surviving spouse. This should not have to have been taken to the Supreme Court, but it did, because Ohio decides that they are not going to recognize a perfectly legal marriage from Maryland because both of these men happen to be men. And so now the Supreme Court is going to decide whether, and it's a big deal, whether the Supreme Court is going to decide whether states that ban gay marriage are obligated to recognize the marriages of other states that recognize same-sex marriage. So this is a huge deal. And if you look at it, I mean, the fact that if you were willing to do that Ice Bucket Challenge, I'm hoping that you will keep this family, Mr. James Obergefell and, the late John Arthur, in your hearts and in your minds as you're, looking at this case. Because quite frankly, if you were willing to dump a bucket of ice on their head, I certainly hope that when the rubber meets the road and, a surviving, spouse wants the simple dignity of having his name on his partner's, on his husband's death certificate, that we can extend to him that basic human right, that we can have this dignity to, such a tragic story. And it's a real shame that, Ohio, has put this family through this and has, taken it all the way up to the Supreme Court. But I'm hoping that the Supreme Court, and that justice prevails and that Mr. Obergefell can actually be given the dignity that he was originally denied, because it's shameful that a case that to me seems very simple on its surface and very simple at its basic human values. It's a shame that this, requires the Supreme Court to intervene. It's really a shame. But I'm optimistic, and I hope you guys are too. And so that was happening in the news today. Of course, the other thing that's been happening recently is that we're learning more and more about the victims of the earthquake disaster in Nepal. And I hope you guys have, taken some time to donate to one of the relief organizations. I personally donated to UNICEF. I'm a pediatrician. My heart breaks when I hear that there's 1 million kids in need of, immediate aid of some kind or the other, whether that's health, food, housing. And UNICEF has done amazing work in that area. And if you look them up and do all the Charity Navigator, background research on, organizations like UNICEF, you'll find that, that organization in particular, only 10 cents or even less than that goes towards their administrative costs, and the majority of your dollar will go to helping out those kids in need. But if you're, looking at other organizations, there's AmeriCares, there's Catholic Relief Services, Direct Relief, International Relief Teams, Operation USA, Doctors Without Borders, fantastic group who, we've talked about on the show before. But please take a time out to, make a donation to the people of Nepal. I think that, this is, the least that we can do is extend them some support to help them get back on their feet. A little bit closer to home, I'm feeling the ground shake from what's been going on in Baltimore, and as many of us are mourning Freddie Gray's murder, it's one of those things where like it's hard to find the words, because I'll condemn the riots and violence. Of a very few troublemakers, and because that seems to be the obligatory thing to do. When you're a progressive, it seems like you have to apologize for a bunch of jerks. And, meanwhile, thousands of people who have been taking to the streets to, share nonviolent protests, their voices are, it's almost like if they don't apologize for the few jerks, the thousands of voices that are trying to speak up for the injustice of Freddie Gray's, family, it seems like, we don't seem to want to hear that until we've apologized for the jerk. So sorry about, these guys damaging property. I don't mean to belittle that, but my thing is that if you want to see more justice done for broken windows than for Freddie Gray's broken neck, then quite frankly, I think you're missing the big picture and the big point that we're trying to make here. As many of my, fellow progressives and activists have, taken to the streets to, yet again, talk about, police brutality and draw some attention to it. In my perspective, I know that it might seem that this is an unusual tangent for a program that deals with, health policies. And, I don't want to get too caught up in the weeds of criminal justice and criminal justice reform. I do think that, Freddie Gray's murder needs to be properly investigated. The police who were involved with his death, they need to be punished. And that police department needs to be reformed with a whole bunch of other police departments around the country. And criminal justice reform is it's long overdue homework that, I think state houses and Congress need to get on top of. But my point as a doctor and as a public health advocate in bringing up Freddie Gray on this program is that in addition to talking about all these questions, on Freddie Gray's broken neck, I feel like we have to also talk about his broken community and the broken health that was in Sandtown, Winchester, where he lived and grew up. I found it particularly interesting to come across a 2011 health profile that was written up about Sandtown, Winchester, and they, the Public Health Department of Baltimore, they did a whole bunch of these public health profiles in 2011 for a lot of the neighborhoods in the greater Baltimore area that were, kind of like immediately close to the, city of Baltimore. And, the thing that is striking about, this profile is that it gives you a greater picture of how Freddie Gray's life was spent and the community from which that most Americans were expecting him to pull himself up by his bootstraps. For those of you who don't know much about Sandtown, Winchester, I didn't before I looked at this report, and I was shocked to find out that 55.5% of households in Sandtown, Winchester are trying to get by on less than $25,000 a year. That is their poverty. Their poverty rate is twice as high as the greater city of Baltimore. Their unemployment rate is also twice as high. Baltimore, it's like 11.1%. Sandtown, Winchester, and Harlem Park, it's 21%. And when you look at, the the hopelessness. I feel I've always looked at school absenteeism as one of those markers that tells you a lot about how do the children feel about their prospects. Like, because the whole idea of giving up on school is a sign to me that you can see how this pessimism is creeping into these poor kids. And it's largely because, I know what these kids are like, because these are the kids that I've always taken care of as a pediatrician. And when you look at like school absenteeism, percent of elementary students missing over 20 days of school. In elementary school, it's only 7.3%. Okay, of the kids, the elementary school kids in Sandtown, Winchester, only 7.3% of elementary school kids have missed more than 20 days of school. Okay, by the time they get to middle school, that number has gone up to 21.5%, as in like it has tripled by the time they get to middle school. And then it doubles again when they get to high school. The number of high school students who have missed over 20 days of school, 45.8%. And to me, what that, I hear that narrative, and I think unlike most Americans hear that narrative, and I feel like they think like, well, these kids just need to get their ass to class, and, they need to stop jerking around to outside, and go to class. And I'm like, yeah, sure, you can say all of that, but what are they going to class for, I think the reason why, a kid like me growing up, in a community like I did, this is like Irvine, California, way different than Sandtown, Winchester, Maryland. But, a kid like me grows up, not wanting to miss school because I see myself on a trajectory where I do this thing for school now, and that's going to help me get into college. I do that thing in college. It's going to help me get into med school. I do the thing in medical school, and it helps me. And, and it's sort of like there's this upward trajectory that I see myself climbing if I do my part. And it's this feedback loop where I do my part, I get rewarded for my hard work. I do the next bit of hard work, I get rewarded for that. Whereas, I feel like these kids are basically seeing that, what? Mom and dad have been busting their butts at, less than $25,000 a year. They don't seem to be doing a whole lot better year after year, despite working this way. Why am I doing the school thing again? And the sad thing is that we have to have a better answer for them. And this is why school absenteeism matters to me so much. But if you think I'm upset about this part, wait until you hear about their issues with lead poisoning. That's right, lead poisoning. Lead, the toxin that we knew was a bad idea in the 1970s. This is a 2011 report. I'm reading about lead poisoning in Sandtown, Winchester in the year 2015. This report was written in 2011, but lead is that big of a deal, okay? To give you an idea of how bad the lead problem is in Sandtown, Winchester, okay. Baltimore, it's 11.8. Okay, so the way to describe this is the 11.8 lead paint violations per 10,000 households, okay? Just hold that number in your head. 11.8 lead paint violations for every 10,000 households in Baltimore. In Sandtown, Winchester, where Freddie Gray grew up, 39.8 lead paint violations per 10,000. So he is living in a neighborhood that has got 3 times as high amount of lead paint violations. And the reason why I bring up the lead paint thing is because this guy and his twin sister were both suffering of lead poisoning when they were much, much smaller kids. Now, mind you, when they were much, much smaller kids was not that long ago. I mean, it's like they were little kids in the early to late 90s, somewhere in there. All right. But my thing is that, by the time this report gets written, Eddie Gray is, more grown, but he is, his neighborhood has still got 3 times as many lead paint violations as Baltimore. Lead? I mean, what irks me so much about this is that, here I am, a doctor in the 21st century. You and I are having this conversation. It is the year 2015. And yet, when we're talking about, what were the health challenges for Freddie Gray, after the poor guy has died, what we're finding out is that that his community struggled with lead. we knew about lead in the 1970s. That's when the EPA started issuing all their regulations. And the thing is that like the EPA regulations are coming after decades of research on lead toxicity. So we actually knew a lot about lead going back almost 100 years, maybe even more than that. But like the scientific community builds and builds and builds. The public health community gathers its data and like, it gathers and gathers it. Finally, in the 70s, we get together and say like, yeah, this lead thing, why don't we stop putting lead in the gasoline? Let's stop putting lead in the paint. And all these places that got paint, like, before 1970, let's little by little, like actually, like go through these neighborhoods and start figuring out how do we get rid of lead paint. But here we are. This report was written in 2011, and we're finding that lead is still, breaking this community. This is what I'm talking. This is why this angers me. Freddie Gray's story angers me as a physician and as a public health advocate. Is that, in the broader context, yes, I'm not going to negate or downplay the importance of talking about police brutality. I think that's absolutely critical and important. But if you want to understand what is ticking off the people that are on the streets in Baltimore is that they are sick and tired of being sick and tired. They should not have to be living in communities with lead paint. Lead paint is still an issue for them in the year 2015. That is a piece of their anger. Their anger is also coming from watching their income stay below $25,000 a year. Meanwhile, they're only 50 miles away from Washington D.C. They're an easy train ride away from New York. These are the biggest, richest cities in America, quite frankly, the world. And the best of these places have to tell a place like Sandtown, Winchester is to pull yourself up by your bootstraps. Well, the truth is that what was Freddie Gray's, what were his prospects when this is what he had as his starting point? That lead paint issue preceded him. That was something that we should have been knocking out before he even got to elementary school. But that's not what we did. We somehow decided that, this community and the lives in it were really just not worth the time. And if you want to prove me wrong, fine, prove me wrong. But then explain how the heck there's this much lead in a community where we knew that lead is something that is poisonous, toxic. I know that my kids are never going to have to live in a lead, are never going to have to worry about lead, And many of the people who get to make decisions about, the lives of Freddie Gray, a lot of them are never going to have to go home to something like lead, And the sad thing is that, when I think that, what gets me fired up about a lot of this is that when I look at the medical and public health communities, I have gone to the conferences and, I see them talking about poverty and I see them talking about social determinants of health. But inevitably, you always hear somebody say, you just got to give it time. Progress takes time. My thing is that how much time do we need to get rid of the lead from Sandtown, Winchester? Because quite frankly, I get it that outcomes might take time, but action, political will, I don't see why that needs time. The thing that drives me nuts about, because the thing is Freddie Gray's story is hardly unique. We covered on this program that, Michael Brown went through similar injustices in Ferguson, Missouri. If we were to dig into, Tamir Rice over in, Cleveland, if we were to, look at any of the communities that any of these young black men and women have been, dying in, we would find that their life is not being given a whole lot of value, and whenever progress needs to be made, we're actually we keep, hearing this thing of oh, that takes time. That takes time. And, I think that to understand the protests, you have to kind of understand that they're kind of sick and tired of being sick and tired, and they're really sick and tired of hearing this thing about time, especially from the people who are supposed to be their advocates. This is what drives me nuts about, the public health community, the medical community, when they talk about, these issues that matter. I'm glad that they're talking about them. And I guess that they can point to their track record that even having the conversation took a long time to even get the conversation started. But the thing is that I do feel like it's important to point out that you're not like that. A lot of people who are having these conversations are not going home to these problems. Like they're not the ones going home to a community with where the median income is less than $25,000 a year. They're not going home to a community where, the unemployment rate is somewhere around 25%. They're not going home to a community with this much lead paint, and it's easy to say that we just need more time, to make progress because, it's not really your pain to bear, is it? Now, I know that a lot of people feel that I'm probably being really hard right now on this rant and that I'm really maybe my anger is out of line and things like that. But, and they're going to probably point to tons of things that have changed and improved, over the years. But I can tell you that the first time that I remember there being riots were the LA riots. I was 13 years old. And that was, for the beating of Rodney King by the police. And at the time, I was a 13-year-old kid at the time. And I remember seeing the city of LA, especially, places like Watts and everything go through a whole lot at that time. And what I find interesting is that when you look at, those riots and you look at, what's happening in Baltimore right now, to me, the things that have gotten, what's really changed over that time is that we've gotten better at recording police brutality. If you look at, the quality of video, it's actually impressively clear, good video. That, when we do capture these things on video, that seems to have improved, when you look at, the number of avenues for apathy, that has improved tremendously. Where, when Martin Luther King first talked about police brutality in the 1960s, there was 3 networks and, the public network. And now we got, there was 300 channels when I was a kid, and now there's 3 million websites to keep you distracted. It's amazing to me that that we seem to be giving apathy so many more exit lanes and avenues off of the main conversation, so that if it gets too troubling for you, or if it gets too just bothersome, you can just go watch another episode of the Kardashians or whatever it is that you want to watch. You don't have to necessarily participate. That's improved. What hasn't improved is the amount of lead paint in in Sandtown, Winchester. I keep coming back to that because it's sort of if I'm going to be told as a as an activist and as a progressive, that these things take time, I just kind of want to get an idea of what kind of time frame are we talking about here? Because I can tell you right now, I'm with the people in Baltimore right now where I am sick and tired of being sick, of watching my patients be sick and tired. I just find it ridiculous that I went to medical school. I started medical school in the year 1999. It's the year 2015, and I'm having to worry about lead paint in my patients who, are probably living in neighborhoods that are not a heck of a lot better than Sandtown, Winchester, it blows my mind that this is what we have to deal with in the year 2015. And quite frankly, I think that the people who are upset at a few looters are really missing, not only the point, but they're missing the opportunity. This is why, I bring up these issues on this program where, talking about minimum wage, talking about paid sick days, talking about poverty, talking about food stamps. The reason why these issues matter is because, quite frankly, these are the things that are undermining my patients' health, the health of lots of patients for lots of doctors around the country. These are the things that we need outside of our clinic in order for our job to be better and for our patients' lives to improve. This is why the show focuses on these things, and that is why every time something like, an incident like Freddie Gray happens, you can believe me, I'm going to be bringing this kind of anger, this kind of passion to the discussion, because quite frankly, I am out of time as far as how much longer I'm willing to wait for some real action, for some real political will to get to the bottom of things, And if you want to prove me wrong, get the lead paint out of Sandtown, Winchester already. All right, I need a little bit of a breather. You've been listening to Dr. America's show here on the WEAC Radio Network. I am your host, Dr. Sanjeev Sriram, and we'll be right back.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.
Welcome back to the Dr. America show here on the We Act Radio Network. I am your host, Dr. Sanjeev Sriram. So for the last segment of this program, I wanted to have a little bit of fun with something that's been that's been frustrating in the news, and that is the quack science, the junk science brought up by Dr. Mehmet Oz on his show, The Dr. Oz Show. So it was brought up in the news recently that there were 10 doctors who these are 10 prominent physicians from some pretty well-known institutions. They got together and they wrote a letter to the Dean of Medicine at Columbia University because Dr. Mehmet Oz holds the vice chairmanship of the surgery department at Columbia University's med school. So these doctors from these prominent institutions, they get together to write this letter calling for Dr. Oz's dismissal from the school. And now it looks like there's well over 1,000 doctors who are signing this petition to, asking for the same. And it looks like it's, really gathering some momentum. And, just last week he gave this really, sorry defense of himself, saying that, he brings the public, and then I'm quoting him, "I bring the public information that will help them on their path to be their better selves. We provide multiple points of view, including mine, which is offered without conflict of interest." Okay, that doesn't sit well with certain agendas which distort the facts. Okay. There are a number of great reporters doing, some responsible journalism to talk about just how much junk science Dr. Oz has pushed on his show. And we decided that we're going to have a little bit of fun here on the Dr. America show. And what I think Dr. Oz needs is a weekly laxative because, when you are so full of crap that you need to get something moving, a laxative is the right prescription. And the way I'm going to write this prescription is that every time, I come across something in the news that Dr. Oz has pushed that is junk science and crap, I'm going to help get rid of it by countering it with, some real science that you guys ought to hear about and that actually is going to make a difference in your life, okay? Now, I'm not going to go so far as to say that you must eat this food or drink this thing, this supplement, or nothing like that, okay? Not going to go there, all right? But whenever Dr. Oz tells you that you need to eat something or drink this or pull some kind of Alice in Wonderland thing of eat this, drink that, grow bigger, grow smaller, whatever. I'm going to call him out on it. Okay. So consider this Dr. America's weekly laxative for Dr. Oz. All right. So one of the products that Dr. Oz has been known to push on his show was Garcinia cambogia. Okay. And Garcinia cambogia is it's supposed to be according to him, it's a tropical fruit that is a miracle worker. And he claimed that it allowed consumers to lose weight without modifying their diet or exercising. Okay, if that sounds too good to be true, it's because it is. There is nothing about Garcinia cambogia that makes the difference, because in a 1998 study, they actually found that, it didn't really make that big of a difference at all. It compared to placebo, no, patients did not lose more weight. So, to get rid of that crap science, let me tell you about some science that actually came out this year that I think is really exciting, and that actually this time, this little bit of science that I'm going to share with you guys actually does make a difference in your patients or in your own lives, and that is that we actually learned that reading to kids, as reading to kids of all ages, especially young kids, makes a big difference. That we actually through MRI imaging, they found a great association between reading to young children and building their brain activity in positive ways. So this is actually really exciting stuff. It got published in the American Academy of Pediatrics, just last week. It's fantastic news, and I'm really excited about it because like most pediatricians, I've been a big proponent of telling parents, read to your kids, read to your kids, read to your kids. And now for the first time, we've got these fascinating MRI studies to tell us that, when you read to kids, you are actually helping the vocal centers of their brains grow and develop. And even better than that, they actually located the part of the brain that is important for imagination. And they found out that when you read to your child regularly, that you are actually building their capacity for imagination. And the technical part of it is that, so we need a part of our brain to help us with taking words that we see and words that we hear and making that connect to images in our mind, so that eventually when this child grows, they're going to want to, and have to read books that don't have pictures in them. But you have to be able to visualize what's going on with what you're reading. And, that's true for whether it's fiction, nonfiction, whatever. Your brain has to be able to visualize what you're seeing on the page. It's a really important skill. It's important to all kinds of different, learning activities. And what we found is that you can actually help your child's brain develop when you read to them. And what I found particularly interesting about this study, and I don't know whether other science journalists are going to be picking up on this, but they actually found that this part of the brain is that all of the stuff with building the imagination center of the brain is actually important for all kinds of kids. And even for kids that are growing up in poverty, their brains are just as capable of building this imagination center when they are read to. So for, my fellow pediatricians out there, if you have been, encouraging your families to read, kudos, that's awesome. If you haven't, get on that bandwagon. It's totally worth it to, encourage parents to read to their kids. If your clinic needs help getting, books, the Reach Out and Read program has been doing a great job of providing age-appropriate books to doctors' offices so that we can, distribute those books to our child patients. And even if you're not a pediatrician, and even if you're not a parent, if you have a child in your life, I can tell you that this is probably one of the most important things that you can, provide for them is not only a book, but taking the time to sit down and read that book with them. I'm so proud of the scientists that started proving this important neuroscientific journey that kids go through when it comes to being read to, and I think that this is the kind of upbeat science news that everyday Americans need to hear. I really don't think that you're going to be feeling a whole lot better after eating Garcinia cambogia, but I can tell you that your kids are going to be feeling a whole lot better after they've been read to, and it's going to show in so many different ways. So really, really excited to to bring you that piece of health and science news. And that has been Dr. America's weekly laxative for Dr. Oz. So I know that we've covered a lot in this show, and I know that we need to kind of wrap things up. So just to kind of recap what we've talked about so far, we've talked about immigrant health and the importance of having truth, justice, and the American way brought into health policies as immigration reform is debated. We've talked about the gay marriage case that's in front of the Supreme Court and how that does relate to the basic dignity that people are going through at the end of their lives, and it is a health issue. We did talk about Freddie Gray, and I know I probably went a little bit all over the place, but quite frankly, if we can't, help resolve some of the basic injustices that the Freddie Grays of the world are going through, then I feel like a lot of these protests are in vain, and I feel that we've gone through a lot for nothing. And then finally, we gave Dr. Oz his weekly laxative with some good old-fashioned science. So, keep reading to your kids, keep helping those young brains develop. And you've been listening to the Dr. America Show here on the We Act Radio Network. I am your host, Dr. Sanjeev Sriram. And until next week, salud to your health.
You're listening to We Act Radio, WPWC 1480 AM. Visit us online at weactradio.com.